In a country with universal healthcare coverage, you might not expect the costs of healthcare to top people's personal worries about getting older. But new research indicates that it is and maybe should be. 66% of those surveyed by Sun Life say their health is their biggest concern as they approach retirement. That said, only 22% have saved money for health expenses in retirement. When you look at those who have retired, we probably should be saving more. 69% say they didn't retire on the date they expected to. 41% of them said it was because poor health forced them into early retirement. And there, the expenses can add up, especially as you age. Last year, the average Canadian reported paying $1,511 in out-of-pocket health costs. Quebecers spent the least at $1,286. Albertans the most at $1,765 a year. Despite those figures, an alarming number of Canadians expect to pay nothing for certain services, such as the 89% who say they wouldn't imagine being billed for a hospital stay, or 79% who expect long-term care residents to be covered. The last word on this goes to Bruce Sellery, author of The Moolah La Guide to Rocking Your RSP. And I mean, you talk to people all the time about their finances, about how we should be saving and planning and thinking about our money. Where should this factor in? I mean, when you're 30, you're not thinking, I might be in a long-term care facility for 20 years, which could happen.
And if it happens, it's an enormous sum of money.
Right.
So if you look at the cost for a facility, it's a couple $1,000s a month. If you want to stay in your home, but you need care to do your laundry and all those sorts of things, if you need live-in care, again, it's thousands of dollars. This is our future as individuals, but it's also in many ways our present, because people our age are dealing with parents who are in this circumstance, and we're starting to see how this plays out. And it's not good. I think the number that I was most surprised by on the what do we not expect to pay for is long-term care. So that $1,500, you can kind of sort your way through that. Yeah, I'm going to have to pay for my own prescription drugs, perhaps.
Maybe glasses.
Maybe glasses, maybe the occasional occupational therapist appointment. But if you go into long-term care, that's a big number. And what StatsCan says, 50% of Canadians, by the time they reach 75, could end up in long-term care.
We were talking about this earlier in our meeting, and the point was made that I think was really good, is if you are elderly and very infirm, you're probably okay.
Right.
It's being elderly, but just kind of in the middle ground. You can still kind of get around, but you might need some assistance. You might need some kind of healthcare at-home coverage.
Yeah.
That's super expensive, and it's not covered. But the thing is, Bruce, does it have to be? Should we start thinking as taxpayers, not just about the looming burden of pensions, but also should everybody have affordable care?
There's no money. There's just not going to be the money. So the two pieces of big picture context here
is everybody should take an elderly person into their home with them.
That's a great idea.
Solve the problem.
That's a great idea.
And because most of us don't want to be our own parents, we take each other's parents.
I'll take your parents. You take my parents are amazing.
Right? My mom's great.
And they still cook. They're very chatty, very social. Now, we jest, but certainly the longer term life expectancy is an issue. It's longer, not healthier. Right. So that's the big piece of context. But second of all, to your point about funding, we are already dealing with constrained provincial budgets. So there are questions about whether or not they'll continue to support the level of benefits that they already support, and whether or not there's going to be income testing and those kinds of things. So I don't think there is more money. I think what there needs to be is more awareness on the part of the individual to save more.
Or we allocate the money differently. I mean, speaking of the individual, you saw the numbers not too long ago that showed that the real kind of gap in wealth is an age gap.
Yes.
That the aging boomers have way more money, even accounting for the fact that that's how it goes. You do get richer as you get older, but on a proportional basis than the the so-called millennials, 25 to 34. So here's the double whammy that's going to hit those kids is the people that might have left them an inheritance one day
are gonna spend it all.
They're gonna need it because they're gonna need it for their own care, and then that younger generation will neither get the inheritance that they might have gotten, and they will also have to deal with their own issues of care.
And they will not have had as secure a job, they will not have the pension, and the house that their boomer parents is able to monetize, they will not have.
Right.
So there's a lot of things systemically. But here's all that said, fear isn't a big motivator for people, I find, because it pushes you so far outside your comfort zone that you're paralyzed. Yeah. So what I really encourage people to think about is what's in it for me to get a handle on my money so that I can have the retirement, not of my dreams, not of the Tuscan, adventure and the Roadster and the Vespa and all that stuff, because that might just be too much.
Just not living with somebody else's kid.
Yeah. Maybe that's
that whole parent swap.
Though I kind of think you've got a neat idea there.
Yeah.
Yeah.
Well,
My
we
mom will
may-
be up by Tuesday at 7:30, and she'll bring her lasagna
I
recipe.
actually think, and I'm not alone in thinking this, but there is this kind of gloomy scenario that with everything that's happening with the income disparity, that we are heading back to kind of a 19th century model of life. And in that model, everybody would live together. Mom, dad, grandparents, children.
You grow a potato
and then
and-
because you can't afford to pay your workers enough to live outside the house, they live in
Right.
the house with you. You call them servants, not workers, but nevertheless.
So then we should be counseling our young people to take advanced training in psychology, because there will be such a need for family
They're going to need
therapists to sort out those
Let
dynamics.
me ask you this, though. One issue around all of this, of the same. Now, Sun Life is a company that sells products specifically
Yeah.
for preparing for medical emergencies. Critical health insurance, for instance, is something. I looked at critical health insurance. It's the kind of thing that your financial advisor really wants you to get,
Yeah.
right? It's super expensive.
Yes.
Are these products good for people? When you talk to people about their own finances, do you advise that they look at this
I
stuff?
advise them to ask the question. So critical illness is a whole other thing. Disability should be a part of it. And there should be a real investigation into what sort of coverage you can get while you're still employed. So continuation of coverage from your employer, a professional association, a union, or private coverage. So I think that's kind of the call to action here is this is going to be important. You need to look at the numbers to see how you're going to pay for it, and what sort of coverage would you line up well before you're no longer drawing a paycheck, so that you've got some sort of something. And if it's not coverage, then it's enough in the coffer to cover these kinds of things that you could almost argue is an eventuality for most of us.
Yes, if we live long enough, but we wind up not so healthy at the end. I take issue with your idea that we won't have to look at universal coverage of assisted living or elder care or some sort of form. I think
not gonna
our
happen.
priorities are going to have to
The
shift.
machine's going to blow up.
And we can spend
Priorities
less. We'll
shift from where?
we'll
From
spend
education?
less, yes.
Higher taxes?
those kids aren't gonna get a
Higher
job
taxes.
anyway.
Amanda Lang advocating for higher
No,
taxes.
well, maybe higher taxes, maybe, because there's going to be an intergenerational shift.
Yeah, I
We're
think
gonna have
there's
to pay
so
for
many
it somehow.
strains on the healthcare system already that adding another layer in terms of long-term care would be completely unsustainable.
Maybe. This is a
Will you play? Do you play bridge? Cribbage?
Cribbage,
Poker.
yes.
Poker. See you at the Chartwell Residences in about 50 years. What do you say?
Chartwell. That's one of those privately
It
for-profit
is.
homes.
Look at their 5-year stock chart. You'd
I'll
be
be
quite
in-
surprised.
I'll be
Talk
in the-
about healthcare inflation.
I'll be in the state-run home. Thank you very much.
You will be? I
Or
can't
somebody's
imagine
basement.
it.
Thanks, Bruce.